Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kosuch. So welcome back to another episode of Patient Journey Pioneers. Today will be pioneered by Graham Gardner, co-founder and CEO of Kyruus, that now serves over 300,000 providers across 700 hospitals and 80 million members across 60 health plans. Is that right, Graham? Still today?
It's actually a little bit more even the update. We're about 800 hospitals now. We have about 500 independent medical groups as well, and about 90 million members now in about 100 different health plan brands. So we continue to grow.
Wow, that's amazing. Great. Hopefully next year when you're back, you'll be able to up those numbers again.
Even more. That's right.
We're crossing our fingers for you. So Graham, you have quite an extensive past prior to Kyruus, including co-founding Generation Health, where you served as Chief Medical Officer through its acquisition by CVS Caremark. You're a Harvard grad, which makes me very proud, and an advisor to the Innovation and Digital Health Accelerator at Boston Children's Hospital. So we have a lot to cover today, but first, give us a quick overview of your journey in healthcare, which will then help us understand your idea behind Kyruus as well.
Terrific. Yeah, happy to. And first of all, thank you for having me on as well. So Liat, I was fortunate to be born into a family that really impressed on my brothers and I how important it was to give back and to make the world a better place. We're also in the healthcare business as well. My father was in the pharmaceutical industry. And so it was, I think, very easy for me to make a connection between being a doctor and being able to kind of give back and help people. And so I was one of these kids that, at the age of 8 years old, declared I was going to be a doctor, when I grew up. But I think having the pharmaceutical industry around the dinner table as well also exposed me to the fact that healthcare was broader than just practicing medicine and that there were multiple ways you could give back. And I think I suspected all along at some point I probably would wander out of clinical practice and do something at the intersection of healthcare and technology. I was really drawn to things and impact at scale. But I love medicine. I love cardiology. It's obviously, privileged to take care of people's lives. And it was also a wonderful learning curve as you're training and getting exposed to more and more and learning. But as I finished up training, I was very lucky in that my father had just retired from Merck, where he was, and actually became an entrepreneur very late in life. And so I now at the age of 30 was exposed to this whole, idea of entrepreneurship and venture capital. And that really became the spark for me to take the technical training I developed and go, help to start things and apply that into the world of business. So I did that via business school. I joined a venture capital firm, Highland, where I had wonderful exposure to a bunch of innovative folks, learned how to begin to build businesses, but realized that during that process that I kept yearning to be on the other side of the table. I wanted to actually go build things. And Highland was super good to me, said, hey, why don't you take the pot of gold then, go out and help us create companies. So the first one, as you alluded to, was a company called Generation Health that we got very lucky and got acquired by CVS Caremark. But it really confirmed for me I love being on the operating side, building product. And actually, I learned and enjoyed selling, actually, which was something I never would have guessed. So we sold that. I ended up hiring my replacement there, came back into Highland and began to think about what to do next. And in the 2010 time period was a really interesting one in healthcare. First of all, healthcare data was becoming more liquid, right? The EMRs were in, things were getting digitized. There was just more movement of data. It was still very messy. It still is very messy, but there was at least some liquidity to it. You had technologies like Hadoop and big data beginning to move into healthcare from other industries. So this ability to process information like never before was there. And the third piece of the puzzle here was Obamacare itself, right? And if we were going to take the healthcare industry on a journey from fee for service to fee for value, we actually needed to understand healthcare data in a way like never before. Who is actually good at doing certain kinds of things, and what is high value care, things like that. And so around that time, I saw the movie Moneyball, and I'd been raised with this worldview that we're all different, we're all beautiful in our own way, we all have our relative strengths and weaknesses. And what Moneyball had embraced was this philosophy that, look, there's not necessarily good or bad ball players, there's just people who are better in certain situations. And you could begin to use data to say, hey, turns out you're really good in this kind of setting, and you're really good when you're in this kind of lineup, and you could build a team that really embraced and played everyone's strengths. And I just thought that was a really affirming way to look at the world. and also realized that we doctors were a little bit like baseball players. You might stink at doing a hip operation. That's okay. The data tells you you're really good at doing knees. Could we begin to do Moneyball for doctors and help match patients and providers in a way that really created this win-win, where patients were getting to the right provider the first time, provider was practicing at the top of their license, what they were really gifted at doing, and you therefore would have better healthcare outcomes. So that became really the founding vision for Kyruus.
Amazing. So, what does Kyruus do really today? If you could, explain in a nutshell, before we start philosophizing and talking about digital innovation and how Kyruus blends into that.
Yeah. So Kyruus is a provider data management and scheduling solution that helps healthcare organizations match patients to the right provider. And I use the word right very deliberately. We don't talk at Kyruus about, hey, we'll find you the best doctor. It's really about uncovering who's the right provider, giving you the information for you to navigate, to the right provider. So as mentioned, we power the provider directories, and then an application layer that allows a call center agent to interact with that data. The patient themselves can self-schedule online, or the referring provider can all now have access to that information and get someone to the right in-network care. But over the last few years, we've also begun to think more expansively beyond that. So, hey, to the extent that patients are starting their search for care in any number of different locations on the local health plan, well, let's publish that information and also have that scheduling be accessible there. They might go to a search engine. They might use a digital health app. How can Kyruus really help support the industry by having that information be available and allowing patients to get in and seek the right care for themselves? And there's really, I think, two elements to that. First is having enough information that you're able to provide the patient, what it is they're looking for. So when we'll go into an organization, we're quite literally pulling hundreds of different data elements about each provider, their name, rank, and serial number, but also their picture, their web bio, the locations, the insurances they take. And so now you have all the information that someone can begin to search on, because the search is different every time. If I need a flu shot, what I really care about is that it's down the street today and it's $10. Probably doesn't need to be a doctor. If I need a bypass operation, I'm likely willing to wait longer, drive further. For my primary care, I may want, a mother like me, or someone who's a runner that speaks my language and takes my insurance. But in other situations, I might prioritize different things. And so again, we don't see our role as saying, hey, this is the best person for you. It's here's the information you need in that moment to figure out what feels right for you in terms of where you want to get your care.
What are some digital transformation projects that Kyruus is working on today that you feel most excited about?
Where I'm spending a lot of my time today, Leah, I alluded to, is how can Kyruus begin to support a lot of the rest of the industry. So, initially we were very much focused on the provider world and helping patients that were coming to a website or calling a call center, find and route their way into the right care. But we realize that patients start their journey everywhere, right? And so how can we be out there for folks? And I think increasingly I see an opportunity for Kyruus to basically be middleware almost between some legacy technology that code was written decades ago, disorganized data that's in dozens of different silos, all labeled differently, and then a modern app experience that everyone is coming to expect from all of their other interactions, in the industry. And I think what's so exciting to me about what's happened over the last 10 years is tremendous enthusiasm, momentum around digital health, right? There's so many people who want to contribute and care, and they're developing wonderful services that cater to certain populations in a virtual way or not a virtual way. But at some point, everyone has to interact with brick and mortar healthcare. And it's hard to interact with, right? That information sits in dozens of different styles. So just as an example, when we're pulling together those 100 different data elements, my picture is in a marketing database labeled ggardner.jpg, but my specialty is in a credentialing system labeled Graham S. Gardner, MD. My location's somewhere else, with an NPI number. You have to be able to put all of that together. Otherwise, every digital health company is trying to go in and sort through all this data and then, wire into Epic scheduling and Athena and, Cerner, et cetera, et cetera. And so, what I see as an opportunity for us is if we can really be that routing platform, help organize that data one time, get efficient scheduling workflows, we can then make that available to other organizations, and they can spend their calories and their time, really enriching their experiences with that community or whatever it is, and then just being able to access very easily the ability to get data and schedule through a Kyruus. And so that's where we're spending a lot of our time is how do you think about developing and supporting that marketplace?
Wow, very ambitious yet very much needed today. And what keeps you up at night when you have these goals in mind and you're striving towards this vision that you have? What is a challenge that you're facing that folks who are listening in, CIOs, chief digital information officers, what can they learn from this challenge and how are you tackling it?
Yeah, I think, to some extent, the last 10 years, I've watched the industry come up a learning curve a little bit in terms of using technology, right? Healthcare was lagging many, many other industries. And I think there was sometimes an underappreciation of the ability to take in best in class, integrate into the workflow instead of building it. And I think a lot of, health systems, certainly 10 years ago, built a lot of things themselves that are very, very hard to maintain. And so, where we spend a lot of our time is quite frankly just trying to help educate folks on some of the technology that exist, trying to work across technologies. And obviously, our companies partner together seamlessly because the extent to which you can be a Lego piece that works really, really well with other Lego pieces, a CIO now can begin to say, "Oh, this is great. I don't, they're doing the work for me of kind of stitching these things together. That makes my life easier." So we think a lot about that. But that I think is one of the biggest challenges that there's so much out there that it's hard for CIOs to understand and how to break through some of the noise. I remember once going to the HIMSS conference, the big health IT conference, and just staring at the football fields, right, of all these vendors.
Yeah.
And I realized, oh my God, that's the inbox of a CIO. How do they possibly sort through this? So that's what I worry about the most is how can we convince folks that, hey, we're a really interesting tool and platform that they can then build on, integrate with other things, and really serve their patients the best way possible.
CIO's inbox. I mean, I think they even have more than a HIMSS football field in there. So I'm glad we can make it easier for them. So that's a segue to ask you about your current integrations. And we will take Kyruus as an example because we know that Hyro and Kyruus are partnering to enable healthcare organizations to enhance their conversational AI experiences. Tell us a bit about the motivation behind that. Not just Hyro, of course, with any partnerships that you guys have, and how is it helping you out today?
Yeah, Leah, I think this has been a part of our own personal maturation too. And I see this as I look out in digital health that, the early years companies, they're very good at describing a problem. They found something and they talk a lot about the problem. We and I think others then go through a phase where you think probably a little too expansively of everything you could do. You're like, oh, and then we could do this, and then we could do this, and then we could do this, and actually you're actually hard to partner with because no one understands what you do, and you're kind of stepping on everyone else's toes, et cetera, et cetera. And then I think at some point, we at least got comfortable to say, look, this is what we do. We're not a telemedicine provider. We're not conversational AI. We're not CRM, et cetera, et cetera. And at that point, then it actually becomes really easy to begin to say, well, who is actually best in class there and how can we best work with them? Because again, the health systems, they need this digital stack of technologies. They need their EMRs, they need CRMs, they need routing scheduling, they need chat, they need ratings and reviews, et cetera, et cetera. And the extent to which you can fit into something neatly where they can understand what you do and the ROI around that, but then also can find ways of integrating with others, then that's best. And so we've really, over the last several years, I think we've developed more than 20 different partnerships with a lot of companies, just so again, we can be that Lego piece that plays well with others, if you will, and it makes it easier for them to select Kyruus because it fits into the overall organizational strategy and tech stack as well.
Do you have any dream partnership for 2023 or 24 that would join the mix?
No. I'll tell you, we're spending a lot of time is a lot of, again, the digital health companies that have grown up over the last several years have had to do their own provider directories and are beginning, just like the hospitals, to realize this is really hard work and it's not my core competency. Is there someone that can help there? And so we're taking that same approach of saying, hey, you probably have a lot of data. You've probably bought some, you're curating some yourself, someone's typing in something. Let us help you begin to organize that. And once you organize, now we can connect you into the marketplace. And so, we're really thinking about the providers and other schedulable entities, right? Freestanding radiology things, mammograms, labs, retail clinics, as part of the supply that people are looking to access. And then a number of different demand channels. And so, payers where, patients are starting their search for care and want to be routed. But a lot of these digital health apps now, if we've organized and provided you the data, you can now participate in this marketplace and be able to route people into the right thing. So we're talking to a bunch of companies to do that.
Let's dive into another topic, price transparency mandates that are happening in the US. The latest deadline was January 1st, 2023. We know that Kyruus is helping their customers become compliant with these mandates. And it seems that you offer an incredible service to those organizations because you have the tech, you have the background, you have the expertise to get your data in shape and compliant, right? So tell us about the work you've done to get you there and also what's next.
So I think the price transparency mandate has been a really noble effort to try to make care costs more accessible to patients. And you know, as you well know, it has been phased in. So last year was really about putting machine readable files in place, just organizing this data for the first time, which I'll tell you was a lot of work, helping these organizations just find, get, and standardize that data. This year is actually way more exciting because now you're actually beginning to put this in the hands of consumers. And there's about 500 or so conditions this year, all of them next year, where people really will be able to understand out-of-pocket costs for everything that they're looking for. But I think the approach that we're taking is that, sure, that's wonderful and that helps check the box. But that really should be a data element that's, again, part of those 100 different data elements that helps you understand who's the right provider for me. And again, sometimes it's going to be very relevant. If there's a commodity type of care, you have a large deductible you're going to be paying, you might very well shop based on price. There are going to be other situations where maybe you've already gone through your entire deductible. It's a $50,000 cancer treatment. Price may be a lot less relevant to you at that point, right? You're dealing with cancer, and quite frankly, someone else is going to pay for it. But I think what we're excited about is to contextualize that, to put the price in along with all these other clinical conditions, the languages, the insurances, as an element that becomes really important to who's the right provider or the right kind of care for me.
A long year ahead.
And probably more than a year. Yeah, this will be several years of work to really get this all right for the industry.
It really seems like you're helping streamline that process for those who are too busy to do so.
That's right.
And regarding the find a provider use case, what are the next steps for that as a service/tool?
You know, a lot of where the technology exists today, Leah, is helping match on a clinical condition to a very specific kind of provider. So we have an extensive library that describes every symptom, procedure, condition, every abbreviation, misspelling, lay terms, right? So someone can type in, sugar doctor or sugar blood. We know that's diabetes, and we can get you to a diabetologist, which is a sub branch of endocrinology, without having someone to understand, how to navigate this complex world. And so that's a lot of where we sit today. What I think has been so exciting about the partnership with Hyro is that the conversational AI allows you to maybe go a step deeper. So, for example, if I type in, heart fluttering, well, that could be a lot of different things, right? If you lay down the pillow at night and you feel an extra heartbeat, that's probably nothing. It's probably PVC. It's very normal. It's actually a sign of a healthy heart, actually. You probably follow up with your primary care doctor at some point. If that heart fluttering actually causes you to pass out and you crashed your car and your sister had, sudden cardiac death 2 weeks ago, that's a very different kind of condition. We need to get you to an electrophysiologist. And so, where I'm excited to go over the next few months and years, Leah, is to begin to say, how can we go one layer deeper and really begin to help navigate people? Because the healthcare, is very complex. And the more information, the more context we have, the better guidance we can give. I think patients are really looking for that. I worry that one of the downsides of digital health is, hey, we just give people a lot of information and it's on them now to figure this out. And I think the reality is there is information asymmetry in healthcare, right? People train for many, many years. Some would argue they're training their entire life. And I think patients, they don't want to be treated paternalistically, but they are looking for guidance. And so the extent to which you can learn about them and again, help make that more informed match and get them to the right care, that to me is really serving society.
What do you think CIOs, chief transformation officers, chief digital officers should be thinking about for the rest of 2023? Perhaps 2 to 3 things that they should have as top of mind.
Yeah, I think, the first thing we've alluded to a number of times, which is think outside the organization, right? So that, yes, you are a destination for care, but people are starting that journey in a lot of different places. And so the CIO, you're not just thinking about your own digital properties, your own call center. It's who else is out there? Is it Google? Is it the health plan? Is it digital health apps? How do you make yourself accessible outside of those walls? And what's the technology, right, that can do that? And then I think the second is, and again, we've watched the industry get much more thoughtful around investments in ROI, right? And I think too often it's like, well, this doesn't cost me anything today. Well, you have 25 people working on it, so yes, it probably does cost you something. So how do you think about impact? That if I'm routing people better not only am I getting the patient to the right provider, not only am I allowing the provider to practice at the top of their license, but I'm actually utilizing all my providers most efficiently, right? Instead of everybody queuing up for Dr. Famous and having a 30-week wait time, while the brand new doctor who does exactly the same thing, she's sitting empty. Let's actually get people to the right provider. Now, as it financially, as an organization, you're benefiting as well. And so I think beginning to think about what's the technology out there, how do I invest in the right things, stitch it together to where I can really have win-wins, across everything.
So, Graham, when, not if, but when we have you back here in 5 years from now, what do you hope to be sharing with us professionally, personally, where you're at, where Kyruus is at? Do you have any kind of long-term vision of what you hope to see?
Yeah, I think I would love to be thought of as a real partner to the digital health industry. I think one of my colleagues used to joke that we'll know we're successful when someone raises a Series A in digital health. Their first phone call is to Amazon to get in the cloud, and their second phone call is to Kyruus to get the provider directory and the integrations, right? And I would love to do that. I think we really see an opportunity to support, to partner, and to just make it easier for folks to serve their particular clients and develop their solutions best. So that would be my professional goal, and then we're seen as a really trusted marketplace, for that data. Personally, I hope I'm still here. It's funny, Leah, I thought early on of myself as an early stage person, like, I had a million ideas, wanted to start all these companies. And I have enjoyed every phase of Kyruus more and more. And, when you begin to really have scale, we've been able now to buy and incorporate a couple of different companies and really stitch together something that can be really impactful. That's really, really exciting. So there's still a couple corners I can see around this. I'm still super excited about what we're doing. And I hope I'm the one that's still here 5 years from now to talk about it.
What is the best career advice you've been given and or would like to give due to your amazing journey throughout life, your professional life, your career now with Kyruus, something that really stands out to you?
Have the courage to go for it. When I sometimes talk about the early years of Kyruus, we always had this vision of Moneyball and how we could route folks, but I thought it was far too audacious. Like, who was I to go tell health systems, I could better route their providers and do this? And so we actually started off in a couple of other areas, in some ways, to use the baseball analogy, bunting our way on. Like, hey, we didn't want to be too, audacious and all the rest of it. And I think we realized after a year or so that it's hard enough to push one ball up the hill. You can't do multiple different things. And if you're going to spend your life doing something, do something you care about and that really can be impactful, and don't worry about failure. And so that's something I spend. I have two teenage boys, and I spend a lot of time with them talking about failure and risk taking and just how okay that is. To, as long as you're getting back up and you have the grit to try again and try again, we learn a lot through failure. And I think your biggest regret is if you don't take the chance and don't take the risk. Now, again, in healthcare, there's people's lives at stake, and so this you have to be very, very thoughtful about how you take risks. But you're only going to make a difference in the world if you go for it. So hopefully I have a chance to do that. So I mentioned I have two younger brothers. My middle brother is an infectious disease specialist. He runs global health at Indiana University. But prior to coming back to the U.S., he'd spent 7 years in Africa, managing one of their hospitals and really taking care of the sickest and was underprivileged. And it's been interesting in his journey coming back to the States that there actually are some global health technologies that actually apply really well to population health in the U.S. And, in some ways, right, what is necessity is the mother of invention, right? People have had to hack things together, figure out how to deal with communities that oftentimes are afraid of coming in. And he's convinced there's a lot of lessons there that he can now translate in Indiana, that, in a first world country that he's learned elsewhere. So as we look for, I'm not necessarily suggesting it's Adrian, but as we look for pioneers, thinking about atypical backgrounds, right, in global health and places like that could also have real contributions to be made in this digital world that we're thinking about.
Great. We're going to have a Gardner brother on this podcast. I'm excited. We'll do a Gardner, series.
Very good. Very good.
I love it.
He's much smarter than me, so.
Thank you so much, Graham. This was amazing. Thanks for your time. And
absolutely, likewise.
See you very soon.
Very good. Thanks for the time. I really enjoyed it.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.